Pelter number of chromosome 47. Bare body is present in Turner syndrome. Transport of lipid from the intestine to other tissues is by chylomicrons. Reverse cholesterol transport is mediated by HDL. Increased risk of coronary heart disease is seen in type 2 hyperlipidemia. Receptors of LDL is B100. Hypertriglyceridemia is seen in dis-beta-lipoproteinemia. Tendon xanthomas are seen in familial hypercholesterolemia. In Marfan syndrome, the defect is in fibrillin 1. In Marfan syndrome, aortic aneurysm occurs most commonly in ascending aorta. Hypermobility of joint and hyperelasticity is seen in Ehlers-Danlos syndrome. Osteogenesis imperfecta defect in collagen type 1. Gaucher's disease is due to glucocerebrosidase deficiency and accumulation of glucocerebrosidase. A 1-year-old boy present with hepatosplenomegaly and delayed milestone on the liver biopsy and bone marrow biopsy revealed presence of histiocyte with PAS positive diesterase resistant material in the cytoplasm. Electron microscopic examination of these histiocytes is most likely to reveal the presence of parallel rays of tubular structures and lysosomes. Father has a blood group B, mother has AB. Children are not likely to have the following blood group O. They may have A, B or AB. A baby's blood group was determined as O, Rh negative. Select the blood group the baby's mother or father will not have. AB is not possible and Rh negative is not possible. The gene that regulates normal morphogenesis during development is homeobox gene. A couple has 2 children affected with tuberous sclerosis. On detailed clinical and laboratory evaluation, including molecular studies, both parents are normal. Which one of the following explains the 2 affected children in this family? Germline mosaicism. Gene for retinoblastoma is located on chromosome 13. Karyotype in Klinefelter syndrome is 47XXY. Mutation in Marfan syndrome is fibrillin 1. Which of the following is a DNA repair defect? Bloom syndrome. In xeroderma pigmentosum, defect is in nucleotide excision repair. All the following are characteristic of Turner syndrome except umbilical hernia. So what are the characteristic of Turner syndrome? Webbing of neck, cubitus valgus and coarctation of aorta. Which of the following procedures as routine technique for karyotyping using light microscopy? G-banding. Which of the following is inherited as autosomal recessive form? Sickle cell anemia. Gaucher's disease is inherited as autosomal recessive. Which of the following procedures has routine technique for karyotyping using light microscopy? G-banding. Inheritance pattern of ABO blood group system is codominance. The chromosomal karyotype in Patau syndrome is 47XX plus 13. Deficiency of enzyme hexosaminidase N subunit causes Tay-Sachs disease. The following are single gene disorder except Williams syndrome. So hemochromatosis, cystic fibrosis and Huntington's disease are single gene disorder. Multifactorial inheritance is known in cardiac septal defect. One of the following is due to point mutation. Sickle cell anemia is due to point mutation. Autosomal dominant gene is one which is expressed in heterozygous state. Chances of an offspring being affected when one parent is autosomal dominant heterozygote is 50%. The following are sex-linked inherited disease, G6PD deficiency and hemophilia. Which one of the following disorder is autosomal recessive? Homocystinuria. All of the following are autosomal dominant disorder except cystic fibrosis. Which of the following is an autosomal dominant metabolic disorder? Familial hypercholesterolemia. Examine the above pedigree chart. Which one of the following disease is most likely for this situation? Beta thalassemia. Mitochondrial DNA is known for all except mammalian myopathy result due to mutation in mtDNA. So mitochondrial DNA is known for maternal inheritance. Heteroplasmy and liver hereditary optic neuropathy is the prototype. A 10-year-old male, although mentally retarded, is able to carry out activities of daily living, including feeding and dressing himself. On physical examination, he has brachycephaly and oblique palpebral fissure, with prominent epicanthal fold. On the palm of each hand is a transverse crease. On auscultation of the chest, there is grade 4 systolic murmur. Which of the following disease will be most likely to have by the age of 20? Acute leukemia. Which is not a feature of Down syndrome? Pigmented birthmark is not a feature. The features are clinodactyly, hypotonia, and respiratory tract infection. Knuckle fold thickness is used to diagnose Down syndrome. The chromosomal karyotype in Patau syndrome is 47XX plus 21. True about Fragile X syndrome are all except large nose. So what is true about Fragile X syndrome? Large testicles, large head, and large ear. False statement about Fragile X syndrome is microorchitism. What is true about Fragile X syndrome? Breakage in long arm of X chromosome and common genetic disorder and long face. Increasing severity of mental retardation of male members over generation as a result of trinucleotide repeat mutation. The following are the features of Marfan syndrome except reduced joint mobility. So what are the features of Marfan syndrome? Arachnodactyly, dislocation of the lens, and mitral regurgitation. Watson and Crick are associated with discovery of helical structure of DNA. Fuel-Gin reaction is a cytochemical test for DNA. Supratemporal lentil subluxation is seen in Marfan syndrome. Splenic macrophages in Gaucher disease differ from those in ceroid histiocytosis by staining positive for lipids. Chances of an offspring being affected when the one parent is autosomal dominant heterozygote is 50%. Inheritance pattern of ABO blood group system is codominance. Neoplasia. Tumor containing cell of all three germ layer is called teratoma. What are hematomas? Development malformations. Overgrowth of a skin structure at a localized region is hamartoma. All are benign mesenchymal tumor of stomach except adenoma. So benign mesenchymal tumor of stomach are leiomyoma, fibroma, and lipoma. Lack of differentiation is called anaplasia. Reversible loss of polarity with abnormality in size and shape of cell is known as dysplasia. How do you differentiate CA in situ from invasive carcinoma? Penetration of basement membrane. When stem cells transform to form cell characteristic of other tissue, the process is called as transdifferentiation. The term tumor progression means sequential appearance of features of increasing malignancy. The most reliable feature of malignant tumor is metastasis. Morphological diagnostic feature of cancer cells is increased mitotic activity. It is true that sarcoma are malignant tumor of mesenchymal origin. Cancer cells derive energy from glycolysis. The correct sequence of cell cycle is G0, G1, S, G2, M. During which phase of the cell cycle the cellular content of DNA is doubled? S phase. Centrosome duplication takes place in S phase. Transition from G2 to M phase of the cell cycle is controlled by cyclin B. Which of the following is not a cyclin dependent kinase CDK inhibitor? P53. All of the following are inhibitor of cell cycle except CDK2. So P21, P27 and P16NK4A is inhibitor of cell cycle. The tumor suppressor gene P53 induces cell cycle arrest at GRS phase. Regarding oncogenesis, topoisomerase causes break in strands. P53 is the most common oncogene mutation causing malignancy in humans. At G2M phase, there is a loss of inhibitor controlling cell cycle. Decrease of telomerase activity causes anti-tumor effect. True regarding oncogene are all except. So what is true regarding oncogene? Derived from proto-oncogenes, oncogenes code for specific protein, causes in vitro cell variation in animals. And what is not true is multiple growth factor govern the gene. What is true about proto-oncogene? Important for normal cell growth and oncogenesis. MYC gene is transcription activator. In the mitogen activated protein kinase pathway, the activation of RAS is counteracted by GTPase activating protein. Amplification of NMYC is associated with which tumor? Neuroblastoma. The expression of the following oncogene is associated with a high incidence of medullary carcinoma of thyroid. RET proto-oncogene. RET gene mutation D is associated with which malignancy? Medullary carcinoma of thyroid. The normal cellular counterpart of oncogene are important for the following function except promotion of DNA repair. So the normal cellular counterpart of oncogene are important for which functions? Promotion of cell cycle progression, inhibition of apoptosis, and promotion of nuclear transcription. An example of a tumor suppressor gene is RB gene, which is not a tumor suppressor gene. RAS is not a tumor suppressor gene. WT1, RB, and P53 are tumor suppressor gene. Endometrial carcinoma, which of the following tumor suppressor gene occurs? PTEN. Growth factor oncogene is SIS. Increased susceptibility to breast cancer is likely to be associated with a mutation in the following gene. P53 is more appropriate than BRCA1. Which of the following mutation in a tumor suppressor agent causes breast carcinoma? P53. Which of the following is known as the guardian of the genome? P53. The following statements are true about tumor suppressor gene P53 except its activity in the cell decrease following UV irradiation and stimulate cell cycle is false. What is true is it regulates certain genes involved in cell cycle regulation. Its increased levels can induce apoptosis, and mutations of the P53 gene are the most common genetic alteration seen in human cancer. True statement about P53 gene are all except wild non-mutated form is associated with increased risk of childhood tumor is false. What is true is arrest cell cycle at G1 phase and product is 53 kD protein and it is located on chromosome 17. Why fetal cell continue to divide but terminally differentiated adult cells do not divide? There are many cyclin inhibitors which prevent cell to enter into S phase in adult. True about P53, it is a tumor suppressor gene. It is pro-apoptotic and encodes 53 kD and arrests cell cycle in G. Tumorigenesis in aging is due to telomerase reactivation. Telomerase causes carcinogenesis. E-cadherin gene deficiency is seen in gastric carcinoma. All of the following is involved in tumor metastasis cascade except tyrosine kinase. So what is involved in tumor metastasis cascade? Fibronectin, E-cadherin and type 4 collagenase.